Well, first of all, it depends on when you say heart disease. If you're talking about coronary artery disease, coronary artery blockage, that's the most common form of heart disease. So there are medical therapies that help slow down the growth of blockage and help lower the likelihood that those blockages are going to turn into a situation where the artery gets full of clot. And that's what we call heart attack. So there are blood thinners like aspirin and some super aspirins like Plavix, clopidogrel, among others. There's some medicines that slow down the heart rate like beta blockers. And there are statins. Statins are very powerful cholesterol lowering medicines. The other thing I should say is if a person has really bad blockage in the heart arteries, in addition to needing a blood thinner, beta blocker, statin, they also may need to have their blood supply fixed. Remember, the whole purpose of the heart artery is to supply blood to the heart muscle. So if there's like a 90% blockage, we may need to improve the blood supply either through the groin or through the wrist in the cath lab done by one of my partners, where they do a balloon and stent job, or open heart surgery done by cardiac surgeons where they do bypass.